Have you ever been told your knee aches are just part of getting older? What if I told you that 5 tiny everyday moves you probably make every single day, are quietly accelerating the wear on your knee cartilage? Stop doing mistake number 2 today. Really. Think about it. Getting up from a chair, stepping into the shower, climbing into a car. Routine things, right? But what if those normal actions are pushing you faster toward osteoarthritis? Have you noticed stiffness in the morning or a twinge when you stand up after dinner? Have you ever blamed it on just aging and kept going? You're not alone, and it's not harmless. These small habits matter for your independence, for staying active with grandkids, and for simply living life on your terms. Now, I'm not inventing this. The science is clear. The National Institutes of Health explains that while cartilage wears down over time, the rate depends heavily on how we load our joints. Mayo Clinic highlights that osteoarthritis risk rises with certain repetitive stresses and poor mechanics, and Harvard Health shows that small changes in movement and strength can protect your knees far better than just resting more. So it's not fate, it's choices. Stay with me for the next few minutes. I'll name the 5 mistakes that most seniors unknowingly make, the exact actions that accelerate cartilage damage, and then I'll show you simple, practical fixes you can use starting today. No fancy gym equipment, no painful routines, just smart moves that protect your knees and preserve your freedom. But here's the twist. Mistake number 2? Nearly everyone does it thinking it's healthy. If you're watching while sitting, you might be doing it right now. So don't skip ahead. The one change I'll ask you to try could make your next walk or your next stair climb feel noticeably easier in just a few weeks. Curious? Good. Let's dig in. Mistake number 1. Rising from a chair by pushing with your knees and torso instead of using your hips and glutes. Sounds small, but every time you thrust your knees forward to stand, you place concentrated pressure on the cartilage surfaces. Over time, that repeated pressure grinds cartilage down. Have you ever felt a sharp twinge right around the kneecap when standing? That's a clue. The better way, plant your feet, lean forward slightly from the hips, and use your glutes to lift. Think hip hinge instead of knee push. It reduces knee load and uses stronger muscles designed for the job. Mistake number 2. Please stop doing this today. Kneeling deep and twisting to one side, or sitting cross-legged for long periods if your knees complain. Especially getting into cars by squatting down with your knees together or rotating your body while the knee is bent. Why? When the knee is bent and twisted, the surface of the cartilage sees uneven pressure and shear forces. Those are the forces that tear and thin cartilage faster than straight compression. Most of us learned to sit or pivot that way because it's easy or helped us get closer to the floor. But over years, those tiny shears add up. If you're saying, "That's me," don't beat yourself up. We can change it. Research supports this. Biomechanics studies noted by orthopedic teams and summarized by major clinics like Mayo show that twisting under load increases cartilage strain. It's not dramatic in one moment, but repeated hundreds or thousands of times, it matters. And the next mistake? It's what many of us did during retirement thinking we were being healthy. Walking a lot, but the wrong way. That's counterintuitive, right? Don't tune out. The fix is simple. Mistake number 3. Relying only on walking for knee health while ignoring strength and balance. Walking is wonderful, but walking alone, especially if you shuffle or have weak hips and quads, can leave your knees doing all the work. If your stride is short or your knees collapse inward when you step, the cartilage takes uneven loads. Harvard Health and physical therapists often emphasize this. Strength matters as much as movement. So add specific gentle strengthening for quads, hamstrings, and glutes to spread the load off your knees. Don't worry. Later, I'll give you 3 simple exercises you can do in 5 minutes a day. Mistake number 4, ignoring body weight and nutrition. I know. Nobody wants a lecture. But extra weight increases the force through your knees every single step. Studies from NIH show that even a small weight reduction can slow cartilage wear significantly. And beyond weight, cartilage needs nutrients. A diet low in protein or deficient in vitamin D and omega-3s can impair repair. So, losing 5 to 10 pounds, ensuring adequate protein, and getting vitamin D tested can pay dividends for your knees. It's not about vanity. It's about staying independent. The 5th mistake? It's the one you've probably heard 1,000 times, but almost never in the right context. And fixing it will change everyday life. Stairs, gardening, grocery bags. Don't skip this. Mistake number 5, wearing unsupportive shoes and ignoring foot mechanics. Think about the last time your knees felt sore after gardening or a long store trip. Were you in slippers or worn-out sneakers? Shoes that lack support or have uneven soles throw off alignment from the feet up, increasing stress on the knees. Also, flat feet or overpronation can make the knee rotate inward, increasing cartilage strain. Simple fixes like a supportive sneaker, a cushioned insole, and orthotics when needed can make an enormous difference. Your feet are the foundation. Fix the foundation, and you protect the house. Okay, here's the big reveal I promised. Those 5 mistakes: pushing with knees to stand, twisting with bent knees, walking without strength training, ignoring weight and nutrition, and unsupportive footwear. They're not just things people do, they're a pattern. And the good news? These are all fixable today. If you do nothing else, stop the twisting and kneeling pattern and add one short strengthening move daily. That alone can slow cartilage wear. Now, practical fixes, actionable, simple, and realistic for someone over 65. 1. Standing up safely. Practice the hip hinge. Sit near the front of the chair, feet hip width, lean forward from the hips, press through the heels, and squeeze your glutes. Use your hands on armrests if you need balance. Try 5 times each morning. 2. Pivoting and getting into cars. Turn your whole body, not just your knees. Keep both feet pointing forward, move your hips as one unit, and use your hands on the seat to lower or lift. Avoid low squats and deep twisting. 3. Your 5-minute strength routine. Try 10 reps of sit-to-stand repeats. Use a sturdy chair. Stand up and sit down slowly, focusing on hips and glutes. Then 10 seated leg extensions each side to strengthen the quads. Finally, 8 to 10 slow, shallow mini squats to a kitchen counter. Only go as low as comfortable, with your knees tracking over your toes. Do this every other day to start. Strength rebuilds cartilage support. 4. Weight and diet tips. Aim for a protein-rich breakfast, like eggs or Greek yogurt. Add omega-3s like salmon twice a week, and keep fiber and veggies in every meal. Ask your doctor about vitamin D and B12 testing. A modest weight loss of 5 to 10% can reduce knee load a lot. 5. Footwear and supports. Choose supportive sneakers with a firm heel and cushioned midsole. Replace shoes every 300 to 500 miles. If you have flat feet or persistent inward knee movement, consider seeing a podiatrist for custom orthotics. Even over-the-counter inserts often help. 6. When to seek help. If you have swelling, persistent, sharp pain, clicking with instability, or trouble bearing weight, see your provider. Ask about physical therapy. PTs are experts at retraining movement patterns that protect cartilage. Imaging isn't always needed first. Movement analysis matters more. Quick recap. Stop pushing with your knees when you stand. Stop twisting on bent knees. That's mistake number 2, and the one I begged you to stop. Add short strength work, mind your food and weight, and wear supportive shoes. Small changes, big payoff. Your body whispers before it screams. Those little twinges, that morning stiffness, the extra effort climbing steps, they are your body asking for kinder treatment. Make these small changes not for looks, but so you can dance at your granddaughter's wedding, chase a grandchild in the park, or garden without dread. Protecting your knees is protecting your independence. Now I want to hear from you. Which of these mistakes surprised you the most? Have you been doing mistake number 2 without realizing it? Comment below. Tell me one small change you'll try this week, standing, shoes, or one of the exercises. If you try the 5-minute routine, come back in 2 weeks and tell us how it feels. Sharing helps others make the change. And if you found this useful, hit like, subscribe, and share with a friend, someone you don't want to see suffer needlessly from knee pain. Remember, your knees don't have to give out just because you're over 65. With a few smarter habits, you can keep your cartilage and your life moving forward. Thanks for watching, and I'll see you in the next video. Your body whispers. Listen.